This video, we're actually going to show a student how to place bite wing radiographs. Bite wings are indicated to detect interproximal decay on patients. So the big thing is we want to make sure that we get open context between the teeth. Now, sometimes people can just have general crowding, and so it may be difficult to be able to open up the context, but ideally, the idea behind doing a bite wing is that we want to make sure that we have open context, not overlapping context. The error that would actually occur if we had overlapping context is called HA, or horizontal angulation. We're going to show you what that means when we do the demo. So another type of bite wing that we would take, we can do horizontal or we can do vertical bite wings. The horizontal bite wings are indicated for anyone that we need to take bite wings on that does not have periodontal disease. The vertical bite wings are going to be indicated for those who have bone loss. So I'm going to show you a little bit of how we actually do the setup or the attachment with the sensor. So if we're doing a horizontal bite wing, this is going to go in the patient's mouth like so, and then we're going to attach the sensor on there horizontally. So when you look, you actually see that this is placed in a horizontal direction, like the sun comes up over the horizon. Whereas when we're doing a vertical bite wing, what we're going to do is we are going to place it vertically, like those vertical blinds at your house are posted on the wall. Okay, so you can see that the vertical bite wing actually goes on vertically. Now the difference between the two is that we actually get more of the bone level, maxillary and mandibular this way, but we get less of the teeth from front to back. Whereas again, if I show you again, we take that off, we show you horizontal, you'll see that you actually get less of the bone structure, but then you're going to get more of the teeth from side to side or front to back. Okay, so they're both indicated. They're both a type of bite wing that can detect interproximal decay. The only difference is that when we're doing vertical bite wings, we actually see more of the bone structure, which that's going to be indicated for more of those perio patients if you're working in a perio office, things of that nature. So let's talk a little bit about what that actually looks like when we place this in the patient's mouth. Okay, so we're going to start on the patient's right side. I'm just going to reposition this so I've got it really nicely centered. Okay, so when we actually go to put this in the patient's mouth, you'll notice that I hold this a specific way. Okay, the big reason why is because if I hold it here, I have very little control and I run the risk of the patient biting down onto my glove on my thumb or my finger when they go to bite down on their mouth. See, like right here. Oh, ouch, he bit my finger. Okay, so you don't want the patient to bite your finger, and also you don't have as much stability. Like it's very hard to hold like this. I feel very flimsy. Whereas if I take two fingers and place it in the ring, another thumb on the outside of that ring, I actually have a lot of control and I can move this wherever I need it to go. And then I also have this other hand free if I need to go in and like retract a cheek or anything of that nature. So when we're doing bite wings, we want to make sure that we don't place this on top of the patient's tongue, because if we place it on top of the patient's tongue, that's actually going to end up causing us to not have a proper seat on the mandible, so we may miss part of those teeth, all right? So what we ideally do is you'll notice the angle that I hold it at. So I'm going to actually dive in with this front corner. Now, if I was working on a real patient, I wouldn't have to put my finger in their mouth to move the tongue. But for the sake of this demonstration, I'm actually just doing that to show you guys how I would dive in with this front corner, kind of work this in between there, and then that way I can seat that properly into the floor of the patient's mouth. The other thing I would need to do if this was a real patient is I would actually need to use this finger to retract the cheek. So I make sure that this goes inside of the patient's mouth, okay? So now what we want to talk about are certain things that we need to look for when we're putting in the mouth. We can't just go willy-nilly placing it in the patient's mouth and hoping for the best, right? So there are specific things that we're going to be looking for. So the first thing that we want to look for is proper packet placement, or PP. Most of the textbooks and other programs that teach around the country in dentistry, they're going to use pretty much all of the same types of errors when they talk about this kind of stuff. So PP, or packet placement, is do we have the specific teeth in the film that we want to see? Well, how do we ensure that we know that happens? Well, one of the ways is we're going to be doing a premolar bite wing. We want to make sure that we see the distal of both the maxillary and the mandibular canine. So the way that we do that is we can actually look at the side of the patient's mouth, and I'm just going to move the camera over here so you guys can actually see from this perspective, okay? So you can kind of see from the side of the patient's mouth. So if I have this back this far like this, do you notice this is the canine and this is the canine? It's too far back. So I'm definitely going to miss my packet placement if I have that for a premolar. So if I pull this further forward, okay, that's going to be proper packet placement for the premolar. Now, one of the other things that we're going to be looking at are vertical angulation and horizontal angulation. So the big thing is that when you're looking at the vertical angulation, when you have the patient bite down, is this, so vertical or VA, is this coming directly out of the side of the patient's mouth? If so, then this is placed properly. But if this was angled down like this, or if this was angled up like this when the patient bites down, then you're gonna end up having either too little of the mandible or too little of the maxilla, or the maxillary teeth or mandibular teeth. So then you would end up needing to do a retake. And the whole idea in dentistry as to why we teach students about these proper techniques is so that way it eliminates or limits the number of retakes that the student would take. And so that's gonna be more time efficient for them, and it's also gonna be better on the patient because it's less radiation exposure in the long run. Okay, so the next thing, so that was vertical angulation. The next thing is going to be horizontal angulation. So if you're looking at this from the front of the patient's mouth like so, at the angulation, so you'll notice that if I have it angled like this, that's not going to be proper horizontal angulation. The idea is that we want the sensor to be parallel with the teeth that we're exposing. So if you look at these premolars, these are going to be the teeth that we're exposing. So if I had it like this, or if I had it way back here like this, that's not proper horizontal angulation. But if I place it like so, that is proper horizontal angulation, as you can see, because you see that this bite block is actually resting on those premolars. So then I would actually have the patient bite down. So now we've checked our packet placement, we've checked our horizontal, and we've checked our vertical angulation, okay? The next thing we need to check is our cone cut. So ideally, we have to have 3 things placed correctly in order for this to line up the way that it needs to line up. So the next thing is going to be our PID, or position indicating device. When you go to line this up, you want to make sure that it is as parallel as possible to the ring. So when you line it up, you should look at it from the front, the top, and the back side. Because let's just say I didn't line it up correctly. If I had it like this, do you see how there's more space down here than what there is up here? So that's going to end up resulting in a vertical angulation error, meaning that I'm not going to get an even representation of both the maxillary and mandibular teeth. Okay. Now the other part to this is, what if I line it up like this? It's still lined up in the ring, but do you see how it's more open on this side than it is on this side? That's going to end up causing a horizontal angulation error, which means that you're going to have overlapping contacts. So instead of the contacts of the teeth being like this, where there's this nice little fine radiolucent line in between the teeth when you look at them on the screen, they're going to end up being overlapped. So they're going to appear radiopaque. So if there was any areas of decay, we would not be able to detect the decay because of the overlapping contacts or the horizontal angulation error. So the other or last error that we're going to talk about is a cone cut, or CC. So the idea is that we want to line it up in the ring, right? So does this look like it's lined up in the ring? It certainly does not. So this would end up resulting in, up at the top, or at the bottom, we're actually going to end up cutting off all of these teeth, so we would not see all of this down here. So then we would end up having to do a retake. So we don't want to do that. So the big thing is, the big takeaway is that you want to make sure that when you place this, that you place it as parallel as possible to that ring, just like so. You don't have to spend a lot of time making sure that it's lined up exactly, or that it's touching the ring, but because some students get to be a little bit hooked up on that. And so you don't want to spend a lot of time as you're learning, because the idea is that over time you become more proficient. But the biggest thing is just making sure that you have it as close to parallel to the ring as possible. Okay? So then one of the last errors that we're going to talk about is going to be the other errors. So other errors could be exposure errors or processing errors if the office was still using film, which that's pretty well outdated, and I don't think a lot of people are using that any longer. But exposure errors. So when you're setting your settings on your actual control panel for your X-ray unit, some units have different settings for different areas of the mouth. So for example, if you're working in the anterior area of the mouth here, okay, you have less bone structure that you're actually having to penetrate through. So your exposure exposure should actually be a little bit less for the anterior teeth than it would be for the posterior teeth. So some control panels might have different settings on them, right? So in our particular dental clinic, we actually have 5 different settings. We have an anterior, a canine, a bite wing, a maxillary PA, and a mandibular PA setting on our exposure panel. So if the student didn't have the correct setting for those, then the film might either come out too light or too dark, okay? So one of the things that we talk about of too dark or too light, the way that I teach my students is if I have less of anything, so let's just say that I use less KVP, less MA, less exposure time, it's always lighter. So less equals lighter. Whereas if I have exposed too much, or my exposure time is too much, or I've increased my KVP or increased my MA, then anything more equals darker. So more equals darker, less equals lighter, okay? So that there is a big takeaway, and that's one of the very first things I teach my students in that first night of lab. We have kind of a discussion about what the difference in distance, how it will affect the image, the difference in the KVP, the MA, and the density. So densities and contrast are terms that you're gonna hear in your dental radiology education. So that's something that's very important. Some people refer to that as radiation physics, X-ray image characteristics, whichever term it is that they're using, they all pretty much generally mean the same thing. So is a film overall too light or too dark? Or as we're looking at it, if it's not overall too light or too dark, but when we're looking at the different dental structures, for example, like the bone, the enamel, the dentin, the free space, the pulp chamber, are we actually able to really be able to tell the difference in those structures? So that way, if there was any sort of dental anomaly or any issues going on, we would actually be able to make a proper diagnosis. So those are very important things that the student needs to look at when they are learning initially how to take radiographs. So it's not just, putting the film in and taking it and hoping for the best. There are actual specific techniques that your instructors will be teaching you. The hope is that by doing these videos, that it's going to help increase your proficiency, teach you little tips and tricks that actually make your radiology techniques a little bit more accurate. So easily reproducible, you're doing the same thing all of the time. So then it's gonna, again, increase your proficiency, and it's gonna make you more comfortable, and it's gonna make you a better radiographer. So, increasing the patient's comfort, less retakes, things of that nature. So that's the goal for this particular film. Thank you.